Thank you, Chairman, for your kind introduction. Good afternoon, ladies and gentlemen. I'm very happy to show you the live surgery. Today, I want to show you a very nice instrument, which is the sinus graft kit. Let me introduce the live surgery case. Okay, the topic of the live surgery is sinus bone graft using the CAS and LAS-Kit. Okay, this is the patient who is the 35 years old male patient. Generally, he is healthy. And he missed the right second molar, left first premolar, and left two molars. He extracted the teeth last year, September and October. In the panorama radiograph, you can see that the remaining bone height on the right side seems about 5 millimeter. And the residual alveolar bone height in the left side seems 3 to 4 millimeter. So the patient requires some sinus bone graft. The right lower second molar is extruded, so occlusal clearance is not so much. And in CT view, you can see that the relatively healthy sinus, although the sinus membrane is slightly thickened, it is within the normal limit, so I don't care. And the thickness of lateral wall seems 1 or 1.5 millimeter. This is my treatment plan. First, right side, I want to access the sinus with a crestal approach using the CAS-KIT, and I will place one wide implant. And the left side, I'll access to the sinus with a LAS-KIT, the lateral window approach, and then I'll place 3 implants. Actually, this is my first plan, but I found that the patient has class 3 malocclusion, so I don't need to place number 7. So I'll omit number 7 and I'll place 2 implants. Okay, wish me luck. I'll start right now. Okay, I finished the anesthesia already, and I want to start with the right side, the number 7 missing site, and I'll use the CAS-KIT, and I'll try crestal approach in this site. Okay, let's start. Okay, I'll make a small incision in this site. The gingiva is very thick. Okay, and okay, left turn. Okay, let's expose the alveolar bone. Well, for good surgical field, I will make a slight small vertical incision. Usually I omit this one, but today I'll show this one. Okay, now the bone is exposed. It's relatively wide enough. And I'll start with the guide drill to mark the implant position. Just mark the implant position with the guide drill. About 5 millimeter away from number 6. And the remaining bone height is about 5 millimeter. So I will start the 2.0 twist drill, and I connected 4 millimeter. Okay, 4 millimeter CAS stopper. Sometimes it is better to connect 3 millimeter for safety. Okay, I'll try 4 millimeter stopper. This is a 2.0 twist drill with a 4 millimeter stopper. Okay. The speed of drill is about 800 RPM. And then keep the stopper and change the drill to 2.8 CAS drill. I think the bone of the patient is softer, so I'll follow the softish protocol. So next drill is 2.8 CAS drill with a 4 millimeter stopper. Okay, let's check if the sinus flow is penetrated or not. Okay, not yet. Okay, next is the final drill is the 3.3 CAS drill with the same stopper, 4 millimeter stopper. This step just enlarge the hole. I don't advance the drill, just enlarge the hole. Okay, with the same speed, I enlarge the hole to 3.3 millimeter. Maybe it is not passed yet. Okay. Then I will advance the drill. So I will change the stop to 5 millimeter. Okay. With the same sight. Okay. Go. It is better to check with the 6 millimeter stopper with the depth gauge. Okay, I cannot touch the membrane, so I will advance the drill 1 millimeter more. The stopper is 6 millimeter. Some dentists like low speed, but I like high speed RPM. Let's check with the 7 millimeter stopper. I think it's almost, but not perfectly passed. So I will use the 7 millimeter stopper. This is 7 millimeter stopper. Same 3.3 CAS drill. Let's check. Okay, it is passed. I think it is passed. Let's test the perforation or not with the Valsalva maneuver. blow your nose. 와서 이야기해줘요. 어떻게 코 좀 풀어보라. 그럴. blow your nose. 코 풀어보라고. Okay, because of translation. Okay. Blow. Okay, it is not perforated. So, it is not perforated and the sinus flow is passed. So, next step is to detach the membrane with the hydraulic lifting system. Here I prepared the 2.0 cc normal saline with the membrane lift system and hold the membrane lifter with the mosquito and with a firm pressure seal the hole. And then inject the saline 0.5 cc slowly and pull out. You can see that the successful membrane detachment. The color of the solution is changing reddish. It means that the membrane successfully detached without perforation. I'm gradually increasing the amount of solution, 0.5 or 1.5 cc, and retrieval. And then I'll inject the total solution. I think it's very successfully detached. Good. Now the sinus flow is passed and the membrane is safely, widely detached. So next step is bone grafting. I'll connect the 7mm stopper to the bone condenser like this. For safety, it's better to use the condense with the stopper. Okay. Here is the bone carrier. Let's carry the bone material and then insert through the hole. I'm using the bias. How much bone is required in this case? I passed the sinus flow with a 7mm stopper. It means that the remaining bone height is about 6mm. And I will place 10mm implant, 10mm length implant. So amount required to cover the implant is 4mm. So I have to elevate at least the 4mm sinus flow. In my experience, to elevate the sinus flow 1mm, the amount of graft material required about 0.2 cc. Theoretically, sometimes when sinus flow is narrow, we only use the 0.1 cc to elevate 1 millimeter. But during the procedure, usually we lost some amount of graft material, and some patient has wide sinus flow. So basically, safely, I like to use 0.2 cc to elevate 1 millimeter. In this case, I have to elevate 4 millimeter, so I will graft about 0.8 cc. Okay. Well, bone grafting procedure is not convenient in the crestal approach bone grafting. As you see, I have to insert the graft material through the small hole, so it requires multiple procedures. It's not convenient. Anyway, it's successfully done. And I will place 10 millimeter, 4.5 by 10 millimeter. In molar side, it's better to place wide diameter, at least 4.5. I like to use 4.5 by 10 millimeter length implant in crestal lift and replace the molar tooth. I think it is almost enough. Almost enough. Then I will place the implant. In these days, some dentists suggest no bone graft when bone height is more than 7 millimeter. I also think so. Even without bone graft material, we can make some amount of bone. And when the remaining bone height more than 7 millimeter, even without bone graft, usually the implant can be survived. Okay, the bone graft is finished, so I'll place the implant. Here is Osstem's TS3 SA 4.5 by 10 millimeter implant. Okay, the speed is 35 RPM, and I'll place the implant. Irrigation, please. Okay. Open, please. Okay. 통역해줘, 여기 와서. Light close, please. Close, slightly close. 조금만 더 모르고 그래요. Light close. Light close. Okay, I checked the pass. Okay, it's good. Okay, good. Open, please. Okay, let me finish. Talk 봐줘. Okay, talk is weak. I think the bone density of this patient is relatively weak, so the final torque is not so high. Anyway, I will submerge this fixture because the opposing dentition, opposing tooth is elongated, so occlusal clearance is not so good, so better to submerge it. Okay, I'll control the depth with the fixed driver. Okay. Connect the fixed drive and finish the depths. Okay, cover screw, please. Okay, I'm connecting the cover screw. You see, my assist always protect the drive not to drop. Okay, connect the cover screw with a light force. Open, please. Okay, irrigation. Let me check. Okay, right side is almost finished. Okay, I think it's well done. And let's close the flap. You see that the CAS-KIT is very safe and straightforward. I always feel very comfortable using the CAS-KIT because I can avoid the melting, and the CAS-KIT is very safe and very speedy to penetrate sinus floor. And the hydro lifting system is also very nice device to detach the membrane. Just with osteotome, we cannot detach the membrane as we want, but with a CAS drill, the hard lifting system, we can sufficiently separate the membrane. That makes the broader and wider contact of grafted material, which facilitated the new bone formation. Okay. Open, please. 잘 안 보여. 실이 안 보여. Okay. Hold, please. 잡아줘. I'm using 405 nylon. I like this suture material. It's very clean and the tissue reaction is very nice. Left turn. Okay, let's finish. This is my last stitch. Hold. 잡아줘. Okay. Now I finished the right side. Okay, go. Now I'll try the lateral window approach to the lateral side. Open, please. Right turn. Right 맞춰주고. I'll make an incision from the posterior side. Posterior vertical lateral to crestal incision, slightly lingually placed crestal incision. And it's better to use the number 15 surgical mesh to make a vertical incision on anterior side. Here. Use good instrument. I like to use the P24G velocity elevator. This is a very fine instrument. Wait a second. Right turn. Right turn. Okay. Okay, I exposed the lateral window, lateral side wall, and I think vertical osteotomy, vertical incision is not enough. I'll make more long vertical incision. Okay, close. Now I'll use the LAS-KIT to open the lateral window. First, I want to draw the outline of the sinus. 입 다물어. Close, please. Okay. Okay, this is the. Okay, I can see the panoramic radiograph, and the remaining bone height seems like this. Bone is not so much. It looks like this. And I will make bone window here. Here. And if needed, one more. But I will place only 2 implants because of the class 3 malocclusion. I need only 2 implants. I think I can make one bone window. When multiple implant case, sometimes I have to make multiple window. But this time, I think one window is enough. Here I prepared the LAS-KIT. LAS-KIT. This is the 7 quadrille, not dome drill. This is the 7mm quadrille, and I connected the 1mm stopper. Okay, and speeder is high speed RPM. Okay, like this, like this. All right, let's try. Here. With a firm fixation, let's grind the sinus wall. I think the wall is relatively thick, so 1mm is not enough. So I'll change the stop to 1.5mm. Okay, like this. and I'll advance the last drill. Let me see. You can see the grayish discoloration around the osteotomy site. So I'll try to fracture out. As you see, it's very easy to open the lateral wall. Okay, it was successfully detached. Let me separate the membrane. Usually, I recommend you to use the membrane separator at initial tool. Okay, with this one, simply you can detach the periphery of the sinus wall. Like this, we can simply detach the periphery, and then with the membrane elevator, we can carefully detach the membrane. Be careful not to damage the membrane, and you must touch the sinus floor always. Okay, touch the sinus floor. Okay, this is anterior. Okay, it's better to hold the retractor by myself. Okay, let's go to the distal side. I can insert the instrument distally. So even the hole is relatively small, I can detach all the part of the sinus. Here I detaching the medial wall, and this is the interior wall. I think it's successfully detached. Okay, breathe. 숨 크게 쉬어, 숨 크게 쉬어라고. Breathe, breathe. Okay, the breathe. Okay, good. It's well done. So I'll prepare the drilling implant site. Open, please. I'll place 2 implants, 5 and 6. So let's check the width of bone. Okay, I'll make implant position. Okay. This guide drill. Okay, this is about 4 to 5 millimeters away from number 4. This is number 5 premolar, second premolar site, and the molar site is here, around here. Let me check the last position. Close, close, open. Okay, it's good. Carefully advance the drill until you penetrate the sinus floor. The anterior bone is relatively sufficient. The posterior molar site, okay, bone is not enough. Let me check the path of implant. Here, this parallel pin to check the implant position and the direction. Okay, close, please. Close. Okay, not bad. Open, please. Okay, I'll enlarge the hole. Open, please. Well, 4.0 and here. Bone is normal density in this site. Okay. Let's graft the material. Here I prepared the bios also. And let's graft. Not this one. Okay, this one is better. Well, the syringe type grafting material is better, but here is the just by us, and I will push the graft material inside the sinus. This one, here and here. 여기인가? 여기 있고 여기지? Okay. I think not so much graft material required. especially premolar area, the bone height is more than 7 millimeter. And the sixth site, molar site, the bone height is about 3 to 4 millimeter. In fact, I like allogenic bone graft material, but it is not available in Taiwan, so I'm using the BIOS. Okay. Well, in the LAS-Kit, not only this core drill, but we have the dome drill. Dome drill is a grinding tool. I prefer this core drill because I can save the bone window. Almost. Let's make a little more graft. Almost. Okay. And almost finished. Right hand. I think it's enough. It's enough, so I will place 2 implants with open wrench connection and disconnect, and again lightly close. Okay. Let's place. This is TS3SA 4.0 by 10 millimeter. Open, please. Okay. Torque is not bad. Close. Okay, good. Open, please. I think torque is very nice. One more. Yeah, this is 4.5 by 10 millimeter. Do not insert the full depth and check the path first. Close, light close is good. Open, please. Then finish. And do not make a full depth installation. Close, please. Looks very nice. Open, please. Then remove the mount. And the final depth is better to control with the depth, the fixed driver here. This is the fixed driver. The torque seems around 30 Newton centimeter. Well, sometimes you can finish with one stage surgery. Let me check the insertion torque of this one. Not bad, actually. I think we can connect to the healing abutment in this situation, where the position of the implant is slightly backal. I think so. Well, how long? Well, actually, I think it's not bad. Close. It's not bad, but if I think about this position, the ideal position is slightly palatal side. Open, please. It's slightly backal. Actually, usually I don't do this. I can finish the case connecting cover screw and close it. Then it's okay. But I want to show how to change the position of implant. I am not satisfied this position is slightly backal and slightly to anterior. I will remove this one and let me show how to change the position of implant. Okay, mount. It is not mandatory, but let me show. Retrieve. I retrieve the fixture. And I'll keep this implant. And with a side cut drill, I'll move the position. To slight distal and palatal side. Well, you may worry about the initial stability if I change the position. Let me try. If the torque is not so good, I'll submerge the fixture. Okay, let's try. I place again. To slide lingually and distally. How about torque? Okay. Close, please. Okay, good. Open, please. Torque is around 10 Newton centimeter. Fixed drive. Suction, please. I can finish the case with a healing abutment or cover screw. For safety, it's better to connect the cover screw. So here I'm connecting the cover screw. Okay, one more. I reposition the bone window. Close, please. Close. Okay. Here I can reposition the bone window. Instead of membrane, we can use the bone window like this. Okay. Okay. Let's close the flap. Open, please. Right turn. Okay, first hold the corner. Next, I'll close the vertical line. You see, my assist is restricting the parallel with the incision line, so it is easy to close this area, and she's continuing the suctioning to make good surgical field. Okay. Pass the mucosa carefully, not to tear. And okay, during the suturing, hold the thread very close to the incision line like this. Do not make too long thread holding like this. This is not so good. This is not so good. Better is to hold very closely. And the double clockwise rotation and pick up the end of the thread and track this side. Then it does not easily lose. Counterclockwise, clockwise. Okay, let's continue the vertical close. Okay. Okay, make a short and simple field, double clockwise, and pick up the end and track this one side and counterclockwise, again clockwise. No, this one. In fact, the lateral window approach sinus bone graft require many steps and relatively advanced surgical skills. Not only the lateral window opening, it requires multiple skills. So just the LAS-KIT, we cannot do lateral window approach. But the LAS-KIT is a nice tool for safe access to the membrane. Especially beginners worry about the tearing of the membrane during the osteotomy. The LAS-KIT will help safe window opening. Okay, I'll use the figure of 8 suits in this site. Okay. This one. I'll continue the figure of 8 sutures. Okay, one more. Okay, half close. Okay, this is the last stitch. Okay. Okay. Ligation. And let's finish. Can you take the radiograph? Okay. Let's take the radiograph. Okay. Thank you for your attention. Hello, doctors. I'm back to show the result of my live surgery. Okay, in the this panorama radiograph, we can see that the right side I tried the sinus lifting with the CAS-KIT, and I think it's not obvious, but there's some dome-shaped bone grafting in the apex of the implant. And the left side, I tried the lateral window approach with the LAS-KIT, and I think the amount of graft material was 0.8 cc, so it's a little bit much grafting. Well, I think the position of the implants are not bad, and it's better to perform second stage surgery about 5 or 6 months later. Because of a nice surgical kit, the surgery was successfully finished. Okay, thank you very much.